Well, new tonight, the president of OHSU in Portland is lobbying the legislature in Salem, urging them to maintain funding for something called Graduate Medical Education, or GME. Dr. Sharif El-Nahal says with the state's budget pressure, there is a proposal to cut GME funding in Oregon by around $12 million. And if that happens, matching federal dollars would also disappear for a combined loss of $29 million.
Why is government funding required for graduate medical education? Well, these really important people in our health system are a major part of our workforce, but because they are not yet licensed in many cases and are not yet completed in their training, they cannot bill for their services. And so in order for us to support and invest in the infrastructure to train them, this funding has been critically important.
Okay, the cuts would not only affect OHSU. There are 5 accredited GME programs in Oregon, though OHSU's is by far the largest. The hospital says around 27 full-time positions would need to be cut if the proposal passes, which simply boils down to having fewer doctors in Oregon in the future. As the majority of the physicians who complete their GME training in the state, some 61%, stay here to practice.
We're seeing these access to care challenges, physician shortages all around the state. So having the residents and fellows in all of these different settings, it would be a really tragic time to be cutting those experiences and not being able to do more of that.
The bottleneck in getting our healthcare workforce, the physician workforce specifically, to the level where it needs to be is in fact in these GME training spots. Actually having places to practice where people will get an adequate exposure to patients in clinical care so that they're ready to become independent.